The morning of July 3rd, my husband left to go to work, and he gave Lindsay a kiss before he left, and he called me up to tell me that she was very, very warm and I needed to come upstairs.
Tuesday, June 3rd, he seemed like he had flu-like symptoms. Davis, a few days before, had gotten blisters from new shoes on the back of his feet. He is having pain in his left leg and was having a hard time bearing weight on the left side.
From the time I had gone to check her temperature and the time I'd gone back up to get her to put her in the van, she was having troubles walking. St. Mary's Medical Center in Kankakee had contacted Children's Memorial Hospital.
We kind of heard something that we felt was alarming.
The PICU team from Children's called back and decided it was best for them to send a helicopter for her instead of an ambulance.
Time was of the essence.
They kept taking test after test after test.
I really felt kind of at a loss for the family because I couldn't tell them what was wrong.
She recommended that we spend the night there just to make double sure.
There's something inside of me that made me really worried.
It was one of those days that you never really forget.
I had a page that the helicopter had arrived and that they needed help.
It's very rare that we get a call like that, very rare.
She was awake but not alert.
I'm feeling her wrist, somebody else is looking at the monitor, we realize that she's lost her pulse. And at that time, she went into full cardiac arrest.
I jumped up on the gurney and started doing compressions.
We started ventilating her through a mask and a bag.
Down through the kind of walkways you need to get to the elevators to get down to the ICU.
Probably had to have compressed her chest 500 to 1,000 times at least in that short amount of time.
Okay, we're in. This is for breath sounds. We got ears.
Somebody do a pulse check.
As we entered the room, I would say there was an easy 15 people, if not more, continuing the resuscitation process in the PICU.
Sats are 84. Breath sounds are good.
In the middle of the night, Davis, his leg had swollen to twice the size that it was before.
It's late part of the next morning, and as they're taking the x-rays, I can see that Davis is changing. He just started to become basically lifeless.
My first response when I walked into the room was actually to have a code called.
What's going through my mind is that he has a rapidly progressive infection, which may be life-threatening.
What's going on? He's unresponsive.
I remember walking in and seeing Davis and somebody cutting his shirt very quickly.
We actually intubated Davis right there in the room.
Got good air movement.
I knew that he needed to get to the operating room quickly, at the very least, to save his leg.
I'm not screaming, I'm not crying, I'm numb.
We are actually running down to the OR because we can see the infection as it's traveling up his body.
I was starting mentally to try to prepare myself for the conversation that you have with a parent when they get to the hospital and the patient has already died.
Once I got to the hospital, my boss met me down in the emergency room, and first thing I asked her is if Lindsay was alive, and she said yes.
It was probably one of the most unstable situations that one could imagine.
Everyone trying to do everything we can to keep her alive.
Her blood pressure was terribly low, her ventilation was bad.
Blood welling up out of her breathing tube.
Toxic shock syndrome, everything shuts down.
I really thought that she was going to end up dying of refractory shock from an infection.
And I made eye contact with Dr. Steinhorn, and he looked at me and he said, "Bring the family back."
And we all put our hands on Lindsay and just told her how much we loved her and she had to keep fighting.
You can't leave us yet.
Stay with us, stay with us.
And then they asked them to leave so that they could continue.
The most concerning thing that was going through my mind is, could I find what was causing this horrendous infection?
We released some of the pressure in his foot and leg.
I had previously seen one other patient who had had a similar presentation, and the source was actually in his abdomen.
So when we opened his abdomen,
We immediately noticed that the muscles that were lining the left side of his back were obviously dead. The source of his infection and the source of all of the pressures in his left leg are originating in this dead muscle.
She said he's alive and that it's very, very, very serious.
It was
unlike anything I'd ever seen before. He was blue and his abdominal contents were exposed.
I was very concerned that he would not even survive the next few hours.
When you resuscitate children, there has to be a threshold at which you say, there's nothing else we can do. And we were getting to that point.
Keep compression going.
I saw him working on her, and he looked up at the clock, then looked at us, and I said, "Don't stop, don't you stop."
We recognized at that point that there were not good breath sounds of air exchange on the left side of her chest.
I quickly scrubbed down her chest and
very rapidly made an incision in the chest wall.
Just entered her chest and the air came out.
And after that point, things actually started to stabilize.
Every time I lay down in the waiting room, I'd wake up and look out the window, and across the street there was a church and see the steeple. At that time, I really thought that, you know, she was going to make it.
I don't know if he was actually getting better, but he wasn't getting worse. And that first night, I was never so happy to have that sun come up. And it still happened.
I remember waking up and I saw my dad, my uncle, and one of my dad's friends. And then I just remember seeing more people and getting better.
It used to be that I cried because I was so sad, and now I cry because I'm grateful that I have her. Good God, Lindsay, you're a miracle.
From the very first moment, we were encouraged to talk to Davis.
We started singing Take Me Out to the Ball Game to Davis.
Take me out to the ball game.
When he came out after being paralyzed for 2 weeks, he could sing it word for word.
A song that he had never sung before.
My doctor heroes are Susan Daly, because she made us stay.
The decision that saved his life.
The other hero to me is Dr. Barsness.
Thank God for Kathy Barsness, because she said she had the astuteness to go up a little higher into the belly.
I was an instrument in saving Davis, but I wasn't the only person that saved Davis. It was a team effort.
Started with a blister on the heel of his foot. That was probably secondary to him wearing new shoes.
When I see Davis now, I think that he's a miracle. And I ask myself often, what do you do with that miracle? And all I keep coming back to is you need to give back.